here we have the setup for rubber dam. A rubber dam is an isolation technique. So the purpose is to isolate certain teeth from the rest of the mouth. This prevents any material or fluid passing into the mouth, as well as prevents any fluid or material from passing out of the mouth. We do it for fillings and for root canals. For the fillings, we're trying to keep the actual teeth dry so it doesn't affect our bonding process. For the root canals, we're trying to keep any harmful chemicals that we use to kill bacteria from getting into the patient's throat. So we're going to show you the technique for doing a rubber dam for restorations today. We have 4 different types of clamps. Is that close enough? Mm-hmm. This one is the bicuspid or premolar clamp. It's for every premolar in the mouth. You can tell the difference because it's much smaller in size than the other clamps. All right, so that's for all the premolars. This one is number 14. It is for the upper molars. You can tell the difference in this one because it's much rounder and it looks a little bit more painful. It's kind of pokey right here. So this is for the top molars. I remember that because 14 is a higher number. This is a number 7 clamp. This is for lower molars. It's flatter looking than the other one. You can see the difference right here. This is the 7 lower molar. This is the 14 upper molar. Okay. This is the number 212, also known as the double bow clamp. This is for all the anteriors in the mouth. So to set up for a rubber dam, first we have to know which tooth we're working on. So we're going to be working on tooth number 29 today, right here. This will be our tooth to be worked on. So when you're trying to choose which teeth to isolate, you need to choose the tooth to be worked on, the tooth mesial, and the tooth distal. So today we will be doing tooth number 28, 29, and 30. So we need to choose the correct clamp. The clamp goes on the most posterior tooth every time, no matter where in the mouth you are. Whichever tooth is most posterior is the tooth that will get the clamp. So it'll be tooth number 30 today, which means that we will choose the lower molar clamp. First thing we need to do is put a ligature, which is a fancy word for a piece of floss, okay, onto our clamp. The purpose of this is in case this clamp pops off of your instruments while you're placing it and the patient swallows it, we can retrieve it easily. This is for the patient's safety and it's a very important part of our process. Okay. The next thing we do is punch our rubber dam. So this is our rubber dam. It's disposable, so it's one-time use only. The way we would choose where we punch it is we draw a cross to divide the rubber dam into quadrants. Okay. Then we draw a rough idea of what the size of what we think a mouth is. It doesn't have to be super exact, okay? So I like to do dots. You can also do just a solid line. I like to go like this. And I think this is about how big a mouth is. All the way around. Next, we need to choose the correct quadrant. The reason is because when we're doing the lower right quadrant, we need to choose the lower right quadrant of the rubber dam. We need to make sure that nothing's passing through the throat. So if we choose the incorrect quadrant, and say we choose this one and punch this one, you can see fluid can still pass through into the patient's throat. Same with this quadrant, same with this quadrant. We need to make sure that we match up the lower right quadrant to the lower right quadrant on the mouth. So I choose 3 holes, 1 for each tooth we're isolating. I like to make a definite mark where I'm going to do it, about 1 millimeter, 2 millimeters apart. Here, here, here. Then we use our rubber dam punch. I like to use it on the biggest hole setting. One, 2, 3. We've got our rubber dam punched, we've got it in the correct quadrant. If for any reason you accidentally punch your rubber dam in the wrong quadrant, you can always flip your rubber dam and it will still match. You don't have to go and punch new holes necessarily. Okay, so there we go, we've got that ready. Next we're going to put our clamp onto the patient's tooth. So the way that we do that is we always take the rubber dam forceps, these are the rubber dam forceps here, okay, with the little notches facing downwards. We match them into the holes on the wings of the clamp. The clamp should always have, this is the bow facing away from your hand and up. Okay, the reason is because when we put the rubber dam clamp, we squeeze and lower it onto the tooth. All right, we need to make sure that this bow is going towards the back. If we were to put it on backwards, you would be able to know, because number 29 is the tooth we're working on. This is backwards right here. See, that's not going to be very useful if we're trying to work on this tooth. This is going to be completely covering it. So remember that the bow needs to go towards the posterior, towards the back of the mouth. So always like this. Even if you're working on a top tooth, the only difference is that put it upside down, and that for the molars you would choose a different clamp. Okay, so put the clamp on tooth number 30, which is the most posterior. You can push on it a little bit to make sure it's all the way down. If you're working on a patient, you want to be very careful not to pinch the gingiva in this process. So try not to go too far down onto the tooth before you let go of the clamp. It's okay to let go of the clamp a little bit farther up than you think you need it. It will slide down on there easily, and that way you don't impinge on the patient's gingiva. All right, we got that process done. So the next thing we need to do is put on our rubber dam. This is going to be a little bit different than it would be on a patient, because our patient here doesn't have any cheeks, okay? But they do have saliva, which makes this process a little bit easier. So you stretch out the most posterior hole, okay? We're gonna put this hole on tooth number 30, this one on 29, this one on 28. So you stretch it out. Don't be afraid to really stretch it. You put it over the entire clamp. The biggest mistake I see made is that people only put it over the bow. You need to stretch it over the wings as well. So you should see the entirety of the rubber dam clamp like that, okay? Make sure that you can see the green of the rubber dam through these little holes. If you see black behind them, it means that a part of the rubber dam is caught on the bows and fluid material can pass back and forth. So it's important to check that. Then we take the next two holes up and we stretch them over the teeth. If your rubber dam rips at this point, you've put the holes too close together. If you have a hard time getting the rubber dam material down in between the tooth, it means that you've put your holes too far apart. You will get used to exactly what is the right amount. Next, you will take an instrument and you will pull your ligature through the clamp like that. You can use a separate piece of floss, or you can use your ligature. You want to floss down in between the teeth to push the material down, and then pull through so we don't pull back up and pull that material back up. Floss down, pull through. Okay, on every interproximal surface. Now we only want 3 teeth to be exposed. You can see back here, we can see a little bit of a 4th tooth here. This tooth is not supposed to be exposed, anything posterior to the clamped tooth. So you take an instrument and you just gently pull the rubber dam up and over that back tooth. Okay, what we're looking for is that nothing can pass through here, that it's all tight and all sealed off on all sides. All right, we're almost done. All we have to do now is put the rubber dam frame and the bite block on. This is the rubber dam frame. It always goes the same way onto the patient, no matter what tooth you're working on. It never goes upside down, and it never goes backwards like this. Think of this little arch right here as space for their chin. It should go on the front of the rubber dam, which means that you can see it at all times. It should never go back behind it. You can poke the patient. So to put this on, I pinch one side, and then I pull this tight over it. You shouldn't have to actually punch this into the rubber dam. The tightness of the rubber dam should keep it on there. Then I do the same to the bottom corner. Pinch, and then pull. Now you can put these around here, but I suggest waiting to do it until after the patient is bit down a little bit onto the rubber dam or onto the bite block, because if you pull this entire apparatus too tight, when the patient goes to close their mouth, this should all be outside of the patient's mouth here. It shouldn't go inside the patient's mouth on their throat like that, then they can't breathe. So if this is all too tight, it's going to pull that rubber dam clamp off. It's going to pop right off. You're going to have to do the whole thing over again. So there should be a little bit of bag in your rubber dam right here. You can at this point though, pull these around. The very last thing you need to do is put in your patient's bite block. The purpose of the bite block is just a jaw rest for your patients. These procedures can be very, very long and it can make their jaw very tired. We also don't want the patient to bite down on top of their rubber dam clamp. So it goes on the opposite side of where the rubber dam clamp is because we don't want them to bite on it. The broad side is for the cheek. The narrow side is for the back of the jaw. So just like that, you should be able to bite, okay? This is a complete rubber dam. If we're working on tooth number 29, we have number 30, 29, and 28 exposed with nothing else. You can see that there's no way for fluid to pass through this rubber dam. And it's complete. So to take it off, all you have to do is take the bite block out, take the rubber dam off, and usually all of it will come off with the rubber dam clamp. If not, you can just pull on it. There we go.